Good afternoon, everyone. Good afternoon. My name is Daniel Linehan, and I'm an orthopedic surgeon and owner at OSMS. And this afternoon we were going to talk about workman's compensation, and just wanted to introduce myself. I am a general orthopedic surgeon at OSMS, and I see patients of all ages. I see patients both at the Green Bay and the Fox Valley location for OSMS. A little bit of housekeeping to go through here. If you have any questions, please type them in the chat area, and I would be happy to answer them. We will probably reserve questions for the end of a couple of brief comments that I have. And I will try to keep my comments concise and leave plenty of time for questions. So the purpose of today's presentation is to provide an overview of the work comp process from a physician's perspective. I will try to give some helpful insights for both patients and companies from each of their perspectives. An excellent overview of the work comp system in the state of Wisconsin is actually available online at the Department of Workforce Development at dwd.wisconsin.gov. dwd.wisconsin.gov. And it actually runs through the process in a very detailed, easy to understand manner, so I would highly recommend looking at that. Also, just a disclaimer, these are my personal comments and interpretations of the system. I am not an attorney or an expert by any stretch in terms of the detailed law that goes into work comp and all of the rules that go with it. Some of my comments may be slightly inaccurate, so it is a very complex system, unfortunately, and it is sometimes hard to understand, so just a disclaimer about that. A little bit about OSMS and what we are doing during the pandemic to keep patients safe, yet maintain high quality care. We have temperature checks for patients, guests, and team members. We have been maintaining a strict mask policy so that patients, guests, and staff have masks on at all times. We have a limited visitor policy, except for those needing assistance or minors. We do like to try and keep the overall traffic load to a minimum. We have been doing additional disinfecting, sanitizing, and cleaning, especially between patient visits, and that's been very helpful. There is social distancing in all reception areas. And finally, there are telemedicine visits available to patients, both new patients and follow-ups, which has helped also limit traffic. So, a couple of words about the work comp process. I first wanted to start with comments geared toward patients. And for those of you who are patients that may be new to the work comp world, try to go through some of the process and the definitions that may be encountered. First of all, what is a work comp injury? Although there are injuries from things that can occur outside of orthopedics, such as chemical burns or noise injuries, damaging hearing, stress and psychiatric illness that can occur from work. Our focus today is going to be, of course, on the orthopedic side of the injuries. And the injuries that occur and commonly are dealt with by orthopedics are split into three sections and three types of injuries that can occur. First is an injury that occurs directly at work and is directly relatable to an incident. Examples would include large objects, for example, that might fall on a worker's leg and cause a fracture. That's a fairly objective incident that occurs that we can tell directly occurred because of something at work. The second category of injury that could take place is exacerbation of an injury beyond its normal progression. Examples of this would be a patient or a worker that has underlying knee osteoarthritis and twists their knee while doing an activity at work. It may make the underlying process progress much beyond its normal progression, and that is actually considered a work comp type injury. And then finally, the third category of injury orthopedically that we deal with are injuries that can be caused by prolonged exposure. Examples of this would be doing the same overhead motion repetitively over many, many years that may ultimately prove to develop rotator cuff tear. It may not be one particular incident that causes the issue, but it's an accumulation of stress on the joint that ultimately matters. So, if an injury happens, what happens from there? What do we do about it? From a patient perspective, it is beneficial to report the injury as soon as possible to your employer. It is best to do this within 30 days from the known injury or onset. In some cases, however, you can actually report up to 2 years after the injury and onset occur. After the report is made, it actually triggers a series of events that ultimately follow. First of all, a report is then submitted to the state of Wisconsin and to the work comp insurance carrier. And it is to be noted that all companies are required to have work comp insurance plans that actually cover workers for injuries. In cases where companies do not happen to have this for some reason, there are actually uninsured plans that the state has set up that can still cover you as a worker. So once an injury occurs, the second thing that happens is a visit to a provider. And essentially what I wanted to note here is that you can actually choose your provider. Now, luckily, many employers do have either in-house work comp teams that deal with injury, or they have people that they work with where the HR department can actually make recommendations to providers, so it can be somewhat employer-directed. However, it is to be noted that it is your right as a patient to pick your own provider. Now, once we get to treatment of injury, a couple of points. Many injuries, luckily, are treated non-operatively, and that tends to mean rest or physical therapy, perhaps the use of an anti-inflammatory medicine for the injury, and activity modification. And given time and the necessary rehab, many injuries heal on their own without surgical intervention. Some injuries, though, depending on the severity, do require surgical intervention. That may require soft tissue repair. It may require bony fixation, for example, with regard to fractures. After the injury starts to heal, typically we will need to reestablish normal motion and strength. And most of the time that involves the help of a physical therapist. That is an attempt basically to establish better mechanics and to prevent re-injury in the future. As the healing progresses, the therapy sometimes then can transition into what is called a work hardening type program. And work hardening is useful before getting back to full duty. It is essentially, if you will, a customized physical therapy program. So physical therapy in this regard simulates or tries to mimic the work environment that you would go back to in an attempt to improve your endurance and maintain durability. It's basically an objective way to measure your progress and test in certain ways that you might be using the injured part before returning to the job so that we can verify that you can do it safely. And there's actually many options for this. Many times the physical therapist that you would be working with either has a different department or has the expertise to simply move into the work hardening portion of therapy. But sometimes it requires a referral to a specialized location. For example, in our area, the Ascension Workers Rehab Program is a good example of an area that has various workstations and different types of equipment that simulate jobs that may require a fair amount of physical activity prior to return to work. So when it comes to return to work, it is actually best for both the patient and the employer to have the patient return to work in some capacity as soon as possible. And of course, this is as soon as safely possible. Patients, when they get back to work, will receive their full wages as opposed to some of the reduced wages that occur when out of work. And companies ultimately pay less for their insurance, the less time off there is for the patient. Restrictions, if necessary, will be spelled out by the provider, and this allows the patient to return to work but not risk further injury or harm. It is always our goal, actually, to return the patient to work in some capacity. As physicians, we will provide restrictions that let the company decide if there's light duty available to accommodate the restrictions. It is very rare for us to simply keep the patient out of work indefinitely or completely. So our goal always is to return as quickly as possible. A couple of definitions about the work comp process as we move through this. First of all, temporary total disability, or TTD. That's the duration of time that the patient will require no work. A good example of this would be if surgery was required in the immediate post-op period. Most of the time it's very difficult to get back into a work capacity. Usually the patient is eligible for 2/3 of wages in this time period. Another term that might be heard along the process is end of healing. And the end of healing date is basically when a healing plateau has been achieved and the likelihood of further improvement has reached a plateau. Ideally, this means restoration of full function. Unfortunately, sometimes full function is not possible. Functional capacity evaluation. So at the end of healing, typically, if there is a question of whether or not a worker can return to work safely, we will use the work hardening as mentioned, but at the end of that program, obtain something called a functional capacity evaluation, or FCE. This is a test and a series of tests that the therapists or rehab specialist will put you through, basically to outline what you can and cannot do. It may require lifting certain ways or twisting certain ways, crawling, climbing, etc., to really then try to compare this with the work description provided by the company to determine if you as the worker can return to that job in a full duty capacity. And it gives us an objective way to tell if you can do that without risking further injury. At the very end of the process, a PPD rating will be determined. PPD stands for Permanent Partial Disability Rating. And essentially what that is a way to determine the final compensation for an injury, in addition to the wages and the benefits that have already been paid. So the state of Wisconsin has a set of tables, or what are called schedules, that have been set up for every single injury. And each injury has been assigned a comparison to complete loss of that body part. So for example, if a certain body part is injured and complete loss is 100 weeks of your wages, and the current injury that you have is assigned a 5% PPD number, it basically means that there are 5 weeks of pay as the final settlement. Sometimes that gets confusing. That doesn't mean that you are 95% perfect or able to do your job, but it is simply a way to figure out final compensation. At the end of the day, if there really is no dispute about this and the settlement between work and the worker is straightforward, the case is closed. It can be reopened, especially if the injury recurs or pain in that region is relatable to the injury, for up to 12 years. If there are disputes, it actually goes to an administrative law judge, and ultimately then the case has to be reviewed to determine if it is covered, and the final details are then worked out. Unfortunately, that's where it can get very complex and sometimes requires the patient to obtain legal help to get through the process. So, work comp process from an employer view is as follows. My perspective is really related to being a good partner from our provider standpoint and what it means to the company. Our goal, of course, is to provide excellent care, and that means to have the expertise or the skill to treat patients, otherwise known as workers, and to restore them to full health in a timely and safe manner. It means easy and quick access to providers. At OSMS, for example, you're able to see a physician the first time you come in and the first visit. Many locations and other healthcare systems use non-physician providers for access, but when you come to OSMS, you immediately see a physician. And that can be done on a same day with an appointment or in our acute injury clinic. Multiple locations are helpful, such as we have, to provide patients flexibility and convenience. And it is extremely helpful to have all of the capability and technology to treat as soon as possible. For example, at OSMS we have MRI, ultrasound, in-house radiologists, and surgery center all in one location. So sometimes the injury can actually be treated from evaluation to surgery all in that same day. We do need expertise to handle all injuries, so that means a breadth and a wide breadth of services. It means having the necessary specialists, for example, hand specialists or foot and ankle specialists, which we also have. And it means the provider needs to be on the low cost but high quality end of the treatment curve. Because we are an independent freestanding orthopedic office and surgery center, sometimes our costs can actually be up to 40% lower than hospitals. So we work to get the patient back as soon as possible. And as noted, we will give restrictions, but basically try as much as possible to limit no work slips. And if you need help as a company designing light duty programs to allow patients to get back to work in some capacity, please let me know and we'd be happy to talk through that. Also, I think from a company perspective, it is extremely helpful to have easy access to patient information and progress. So excellent communication is really a big part of the treatment process. At OSMS, we can set up programs so you have the physicians or the providers taking care of that patient have their direct email or cell phone numbers. That's certainly the most direct way to contact. We also work with each company's in-house work comp team to give immediate updates, and we are happy to work with case managers if and when they are involved, either directly in person or by immediate update by phone, email, or text as well. Interestingly, the most common cause of delay in work comp cases actually is not enough documentation from providers. So it's certainly our goal to provide as much information and documentation right out of the gate so that there is no hold up in the overall process. And ultimately, the provider really needs to be able to work with the company to understand their needs. We do our best to obtain as detailed of a job description review as possible so that we have a knowledge of the job and what the patient is looking at getting back to. Sometimes this is actually very helpful for us as the providers to visit your company. It allows us to really get into the details of what the occupation is, what the requirements are, and what the potential risks are for the employee. And we are happy to work with companies on the prevention side of the injury spectrum as well. So getting into a good prehab type program is always helpful in an attempt to prevent injury. We like to work with companies here basically to find creative solutions to solve their problems. At OSMS, for example, we are able to customize the cost structure of work comp and try to combine it with creative return to work situations. And many times this is done on a one-on-one basis with companies. So for more information about that, please contact me. I can be contacted directly through our office number at 920-430-8113, or I can be contacted by email at dlinehan@osmsgb.com. So that's dlinehan@osmsgb.com. So in conclusion, I hope that this has helped kind of outline the process a bit. If experiencing pain or discomfort or any injury that might warrant a visit to OSMS, you can request an appointment online. Our general office email is osmsgb.com, or give us a call to schedule. And again, the number is 920-430-8113. So thank you very much for your attention. I'd be happy to field any questions if you have any. So please use the chat button if possible. Just taking a look here to see if we can find any questions. And at this point, it looks like we do not have any further questions. So thanks again for joining me. If you do have any comments, I did set up my email address for you and phone number for the office. So don't hesitate to give us a call if you have any further questions or comments. So thanks again for joining us. Have a great day.